So I'd like to thank the Connecticut Challenge for inviting me today. It's always wonderful to be back in my home state. Today I'm going to talk about young adult cancer survivors, a group that I work with both clinically and in my research, and hopefully illuminate some of the unique needs and issues for this population. So in terms of young adults with cancer, as I'm sure many of you know and have seen in your practices, cancer does occur in 1 out of every 200 older adolescents and young adults, which leaves us with about 72,000 adolescents and young adults diagnosed with cancer each year in this country. So really, cancer occurs actually greater than 2.5 times more common between the ages of 15 and 30 than in the first 15 years of life. But I'd say if you look at the research and where the research is focused, it's really much more focused in pediatrics and older adults than it is in this group. From the early 1970s to the late 1990s, the cancer incidence among this age range, so from 15 to 29-year-olds, rose faster on an annual basis than those diagnosed with cancer in younger or older ages. Still only accounts for about 5% of invasive cancers, however. Well, before I go on, I guess I just want to go over some of the definition of what AYA oncology is. There's a bit of debate, and the literature is in a bit of disagreement. In 2006, the SEER report, which is some of the most frequently cited data, used 15 to 29-year-olds to really define the adolescent or young adult range. Also in 2006, the Adolescent and Young Adult Oncology Progress Review Group gathered together, sponsored by NCI and the Lance Armstrong Foundation, a group of us around the country who really settled on an age range of 15 to 39 years. And that's really the age range that I'm going to focus on today. It's really the age range that I think we've really agreed on in this country. Today I'm going to focus on those individuals diagnosed during the 15 to 39-year-old age range rather than focusing on young adult survivors of pediatric cancers. While most of the literature and most of our clinical research has been focused on young adults who are survivors of pediatric cancer, I think I want to use today to really highlight the unique needs of those individuals diagnosed during adolescence and young adulthood. So when we look at the SEER report data, this is data that was out in 2006 looking at the distribution of cancer diagnosis in the 15 to 29-year-old age range. You can see here it looks very different than when one looks at the adult data that's been presented earlier today. And in fact, if we break it down by age category, you can see, with the exception of lymphoma really leading the pack, that the distribution does look very different based on the age range. And I just wanted to give you an idea of what kinds of cancers these adolescents and young adults face. In terms of risk factors, at this point, with our knowledge, there's relatively scant data to support either environmental causation or inherited predisposition. In fact, familial cancer syndromes really only account for less than 5% of cancers in the young adult group. The incidence, as I said before, has been increasing steadily during the past quarter century. And there's been a lack of progress in survival improvement among older adolescents and young adults relative to other age ranges. And I just wanted to show you what that looks like graphically. So if one was to look at the average annual percentage of change in 5-year relative survival rate, and we look at the age of diagnosis on the left, really looking at everybody lumped together. On the right, the bars are split by gender, with blue representing men and purple representing women. If we're just to look at this young adult range and look at the annual percentage change, you can see we're not doing a very good job. And in fact, the survival improvement trends really do portend a worse prognosis for young adults today with cancer than 25 years ago. And this deficit actually seems to be increasing as we have longer follow-up. And this is not limited to the US. It does seem to be a global problem. So why this lack of progress? There's clearly a couple factors that we think are related to this. Lower rates of participation in clinical trials, maybe some factors inherent in the disease. In fact, the biology of tumors for the same diagnosis for example, in an adult and a young adult are actually very different. The tolerance of therapy is different for young adults than for either younger patients or older patients. There are clearly some factors inherent in the system, primary care, physicians less familiar with diseases that make up cancer in this age range. There's clearly a delay in the recognition of malignancy, both systemically and also from the patient. And there are a lack of available clinical trials for the young adult patient. Certainly there is an unwillingness to participate in clinical trials from young adults. They are notorious in delaying seeking of medical attention, and they do have poor compliance with treatment. So that's just to give you a sense of what it looks like for someone at diagnosis, but what does this mean for our survivors? The thing I want to emphasize today as I go through today's talk is really that young adult oncology survivors belong to a very unique age group. There's a small but growing body of literature really looking at the young adult survivor, and we do see that their biomedical and psychosocial needs are unique. And it complicates the life of a person at an age range when their lives are already in a constant state of flux and already at a heightened vulnerability to stress. They're also at this interface. I said here they're at an interface of pediatric and adult oncology, but I think they're at an interface of pediatric and adult medicine. I should be more broad, where most of our healthcare system is really split for pediatrics and adults. And in this young adult range, some of them are still being seen by a pediatrician or potentially a pediatric oncologist for their treatment, and some are being seen by an adult practitioner. So they experience complex psychosocial environment, and this leaves them with certainly unique developmental needs, both for the patients, the families, and for the healthcare providers. Just in terms of physical late effects, I don't want to go through these. Most of the presenters covered these already, but they do vary depending on the age of diagnosis and treatment. And many of our survivors face many of the late effects that other presenters raised, including neurocognitive effects, cardiotoxicity, infertility, second primary malignancies. So I guess in order to understand this complex psychosocial environment, what I wanted to do is take a step back and really look at what are the normative developmental milestones for an adolescent or young adult, and then think about how these interface with the world of cancer. So what's going on for an adolescent or young adult? Well, they're establishing independence. This is a time when they're individuating from the family, gaining a sense of self, forming their own identity. Certainly is a time of social, sexual experimentation, forming or maintaining a variety of different relationships, friendships, romantic relationships. This is a time when relationships with peers takes on actually more importance sometimes than relationships with family. There's a focus on school, jobs, or careers. Depending on where we are in the continuum, people may be starting a family or already have young children and be caring for young children. This is the time when health behaviors are established, and we know that for many health behaviors, if they're not established by a certain age, it is very difficult to change. So if you haven't started smoking by the age of 19, you are unlikely to become a smoker. They're finding their place in the world and really making independent choices, and that includes becoming independently in charge of their health care. The other thing about this age range is there are many transitional milestones that occur, and these transitions include these and probably many more that I've listed up here. Cancer can really impact the current transitional stage someone is in and in fact set them back. So it's not infrequent that I will see a patient who might be 25, 26, 27 years of age who's still in college because they lost time due to treatment, and now as a survivor is really, they call it catching up or making up for lost time. So what can cancer impact? It certainly can impact all of these: sexual and body image, romantic relationships, friendships, work, fertility, self-esteem. The list goes on, and I'm hoping to break this down a little bit further and talk about each of these. So it really does present our survivors with a major developmental challenge, and I would argue this is beyond the challenge they're already facing as young people. These are some common questions that survivors will ask, and I just wanted to put these up here to sort of frame the rest of the presentation and to really think about whether you've encountered these and how you might answer these. Where can I find information relevant to my age group? Will this derail my career aspirations, my goals for the future? This is a really common one that I hear. How can I find other patients to talk to who aren't my grandparents' age? Will I ever be able to have children? And then a very big one, how can I pay for treatment? So one of the ways we can start looking at the needs of this group is really to go to the survivors themselves and ask them. And there's a recent qualitative study that came out looking at adolescent and young adult survivors, and they identified some of their highest priority needs, both their healthcare needs and their counseling information and supportive care needs. They identify their highest priority healthcare need to be having adequate health insurance, no surprise. Finding ongoing medical monitoring for their long-term effects, figuring out a system for transitioning care from the oncologist to the primary care practitioner, and where do they get evidence-based guidelines for long-term follow-up care. In terms of their identified counseling information and supportive care needs, they really asked for individualized information presented to them at the completion of therapy, really giving them a sense of what their risks are, their late effects, and what they should expect going into survivorship. Information about sexuality, fertility, and reproductive risks. This is a big one, opportunities to meet other young survivors, and really looking for the ability to express and cope with their feelings about cancer, including this desire to return to normal or to establish some sort of new normal. So I've broken these down into 7 major categories that I'm going to go through. Practical issues, knowledge, health behaviors, interpersonal issues, emotional issues, sexuality and fertility, as well as some existential and spiritual issues. So what are the practical issues for this age group? Well, they're less likely to be insured at the time of diagnosis. They're less likely to have financial resources to really deal with the financial impact the cancer may have on them. And they may have increased needs for transportation, childcare, and this really does leave lots of our survivors in a financial bind. After therapy, in the survivorship phase, if they're not in a job that provides them with health insurance, many have difficulty getting their own health insurance. And I can't tell you the number of my patients who can't get life insurance or disability. They're just outright denied. And so they're not a group of survivors who carry this already because they're at a young age. It's very rare for us to see someone at diagnosis in their 20s or 30s who has life insurance or long-term disability. In terms of school or work, certainly there are some setbacks in education and career goals. They face something called job lock, and this is very different than job loss. Job lock is really feeling like you're stuck in your current job and you can't leave. One of the primary reasons for this is because of the benefits package. And survivors really will say, I can't go because I have health insurance that these hospitals take. And we'll see if healthcare reform changes this, but right now this is a big issue. And really the other big issue in terms of school or work are having gaps in your resume. How do I explain this to a potential employer? How do I explain that there are these couple years here where I wasn't working because of treatment, and do I have to disclose that? In terms of the healthcare system, they really do experience a lack of fit in a healthcare system that really does bifurcate pediatric and adult and really does not have a lot of opportunities for an adolescent or young adult healthcare. And they may have greater difficulty locating or accessing primary care providers. And in fact, many of our survivors at diagnosis don't have a primary care physician. So when we talk about transitioning them back into the community to a primary care practitioner, typically we're not transitioning them back, we're transitioning them to. So all of these really may influence their adherence to medical recommendations, as well as their sense of independence and control over their lives. They're also a highly mobile group, and so getting them in for medical follow-up and continuation and adherence is very difficult. In terms of survivorship knowledge, I would say that really their information and knowledge about their diagnosis, treatment, and long-term effects is poor. And this is probably due to a number of things. For the younger part of this cohort, it's probably that this may have been communicated to their parents at the time of diagnosis, and there's a gap in communication there. I think the other thing is they're young, and they may or may not be listening very well, and they may or may not feel like this is something important to take with them. But we know from research that when we ask them what was your diagnosis and what was your treatment, they cannot answer that question. And so for them to be able to get the appropriate follow-up and know what the appropriate follow-up is, we need to close that gap in knowledge. And this clearly may impact their long-term health behaviors and medical follow-up because they may not know. In terms of their health behaviors, myself, as well as a variety of my colleagues around the country, have really demonstrated that smoking rates in young adult survivors is equal to or just slightly less than their same age peers. This is abominable given their risk for late effects, and we really need to bring this number down to 0. Their use of tobacco, alcohol, or drugs really may reflect either a lack of knowledge about the late effects, or really, I think, probably equally so, just a desire to fit in with their same age peers, and they just want to be normal and act normally. And again, if they have this lack of knowledge about their late effects, they wouldn't even know that they need to be treating their bodies any differently. They also have less than ideal adherence to follow-up recommendations. Kevin Effinger and I, several years ago now, published a paper looking at mammography in a high-risk group of female survivors who had had mantle radiation, and they're at increased risk for breast cancer. Their risk is actually 1 in 5. And we found that 47% of this group never had a mammogram. And this is a group of survivors, in fact, that are part of the Childhood Cancer Survivor Study. We educate them. They're part of a cohort. They're actually probably middle to upper middle class. They're mostly white. This is not a disadvantaged group, and they are not getting the screening that we are recommending. So we really need to close that gap. In terms of the interpersonal issues, certainly relating to family, peers, and health professionals is important for this group. And it's not uncommon for our young adults really to express, both in the research we've done and in my clinical practice, that they experience a dramatic change in their friendships and a sense of isolation from their same age peers. This is due to a number of factors that we've identified. In part, it's due to the lengthy time away from homeschool or work. In part, they report to us that they feel more mature and they have great difficulty relating to people their age. They call it the silly problems my friends are worried about, and that really they've had this life lesson and it's made them more mature. And so really great difficulty relating to them. And then really major issues about dating and disclosure. This is something we deal with at Memorial. It's actually one of our more popular lectures that's offered by one of our post-treatment programs is how do you disclose this? When do you disclose this? What are the nightmare stories people have when dating and disclosing a cancer history? One of the most endorsed things in the literature is that these survivors are looking for peer survivor support. So not just support from the friends they had before cancer, but really looking for other young adults that have had cancer and are cancer survivors to connect with. I'm sure many of you face this in Connecticut, but I can tell you, being at a large institution in New York, we face this as well. There is limited face-to-face contact with same-age cancer survivors. If you talk to a breast cancer survivor who was diagnosed in her 20s, she will tell you in the waiting room she only saw women in their 70s and 80s, and she really did not get to meet a lot of other young people. With increasing technology, I think though we have greater opportunities to connect people, and I think we have to think about utilizing some of these. I think it's probably none of us at any of our centers are going to have enough young people to gather them together, but really whether we can connect people via the internet. This is a quote from a survivor of Hodgkin lymphoma who was participating in a writing group. She was diagnosed in her early 20s, and she said, "The problem wasn't a lack of fellow survivors. In fact, our ranks have tripled since 1960 to more than 10 million. But many of them are over 65, according to the National Cancer Institute. We, in our 20s and 30s, make up only 5%. and our fears and hurts and furies are often different, something that becomes clear in what my classmates and I wrote. And this is a great quote I like from Heidi Adams. Heidi was diagnosed with Ewing's sarcoma, and those of you who don't know, she is the founder of Planet Cancer and now is the Senior Director of Engagement at Live Strong. She said, "Cancer is scary, isolating, and bizarre enough without having to go through it alone." She recalls, "I went to a support group and I was surrounded by people who were my grandparents' age. I thought there have to be more people out there like me." We know that peer support with other survivors can improve psychological well-being, decrease distress, decrease anxiety, and improve coping. And in fact, in a recent study, 96% of young adults ranked opportunities to meet other young adult survivors as a top 5 need. In terms of emotional issues that this group face, if you look at the data and you look at the literature, really most of our young adults score relatively normal on our psychosocial instruments and quality of life measures. But I think more importantly, there is a significant minority that experience ongoing psychological or social adjustment problems. This includes anything from diagnosable depression, anxiety, and mood disorders to post-traumatic stress symptoms. I think a larger proportion really are dealing with the emotional adjustment to the natural disruption, or the disruption, to the natural course of development. And this, I think, is a larger proportion of our survivors. In terms of risk factors, if you wanted to identify who your highest risk survivors are for emotional difficulties, I listed some of them here. You're really looking at those survivors that maybe had a temporal clustering of other stressful medical and life events, prior experiences of poor coping, certainly pre-existing emotional problems or psychiatric diagnoses, family discord, extent of disease, and treatment severity, poverty or other environmental stressors, the degree of distress, any residual disability, and lack of social support. And these all increase risks for emotional issues in young adults. When looking at their common emotional concerns or worries, these are really the areas we've identified in the literature and also in our clinical practices. Their physical health status and body image, self-esteem and identity, worry about their immediate family's welfare, especially for young adults who have young children, relating with others in their social world, feeling very different. For adolescents or maybe younger young adults, the sense of invincibility has been lost, and so the introduction of a sense of vulnerability, a sense of lost time, and then lost possibilities for future, and that includes really having children, job opportunities, and really continued care. Who's going to give me attention? Who can I turn to in the medical community? And who's going to provide that care? In terms of sexuality and fertility, this is one of the, I think, under-addressed areas, not only for this group, as we heard earlier today, but for survivors in general. But definitely treatment can have vast impact on sexuality, intimacy, and the formation of mature, committed relationships, which is pretty salient to this young population. Many of our survivors report the lack of pre-treatment counseling about the potential for infertility. I think some of this is true. I'd like to think we're getting better at this, at diagnosis. And so I think some of this is also that at the time of diagnosis, when they're being told of this potential side effect, it's just not a time where I think that's being heard. There's a lot of information thrown at them. And so my advice is really that we have to keep repeating this. This is a group that does report that the loss of fertility is one of the most devastating effects of their cancer. And when you ask them which was more upsetting, the fact that you might die or the fact that you might not have children, overwhelmingly they endorse the fact that they will not have biological children or might not be able to have children. In terms of existential or spiritual issues, young adults really define uncertainty as more than living with the unknown, but also as not knowing what to expect. There are many existential issues raised by young adult survivors, feeling alone, questioning one's life's goals, but I think this doesn't have to be a negative. Certainly we see there are many positive effects as well, and people will talk about that it can be a very big catalyst for personal growth, a deepened appreciation for life, greater awareness of life's purpose, having your priorities in order, and certainly many survivors report that they develop new confidence, resilience, and optimism. So I thought, as a nice illustration, I have a short video clip that was put together by the Live Strong Foundation. A bunch of us were instrumental in working with them to put together a nursing module. Many of you may have seen this, but I think it illustrates some of the unique issues that our young adults face.
I didn't know anyone that was my age having cancer.
When I told like my closest friends, they were like, oh, you know, I'm sorry. Like they didn't know what to say.
Because I didn't want people to treat me different, and so I didn't want everybody knowing.
As nurses, oftentimes we forget that developmental issues are important for every single age.
There are providers who, you know, if you did a pretest, would say to me, there's no difference in how I treat a 20-year-old and a 60-year-old. And then I'll start naming off issues and data.
When I got sick, I mean, the idea was that at this point we should have kids, you know, and I got sick right when that was supposed to happen.
For someone that's used to working 12 or 14 hours a day, suddenly doing nothing was really hard.
I've always been an independent person.
She'd just become a CPA, was working a lot of hours. Her career was just taking off.
When you're younger, it's supposed to be this, you control your destiny, you can do anything.
I felt like I had lost 200% control of myself.
How can you tell me that giving a fertility impairing drug to a 20-year-old who hasn't had children and hasn't had the opportunity to have children is the same as giving that drug to a 60-year-old? How can you tell me that it's the same to treat a 25-year-old who's been on the job for 3 months and is worried about whether 2 months of therapy and all the sick leave is going to impact their ability to climb a ladder, than giving that same therapy to a 55-year-old who's going in for the gold watch in a few years, and the whole community is like, oh, take whatever time you need, we'll be supportive, and we'll get so-and-so to cover you.
And that's one thing, we were always in control. We always were self-sufficient.
Yeah.
We're both full-time students, and I was about halfway through term. I don't know what's coming next. I've never known anybody with leukemia.
One of the things we hear young adults say often is that they just felt so isolated going through the experience.
In the beginning, it seems so unlikely that you're ever going to feel normal again. Friends and family want to understand, but they may not be in the hospital. They may not see the person when they're getting their treatments.
And all the videos were all tailored towards like older people. I mean, we noticed that right away, and I'm making fun of it because it's like, this is kind of hokey, you know? It's like, it has nothing to do with it. These people aren't going through it. I'm going through it all.
There's a role that I can provide as a member of their larger care team to be age appropriate, to smile, to ask them about their day, to talk to them about things that I would want my friends to talk to me about.
I'm going to go paintballing with Haven in a few days.
I always try to make sure I know, when their proms are, when their important sports events are, what sports teams they like, what music they like. Let them know that I think of them as a person going through something horrible, not as just, a patient.
I know that there's not a perfect way to deal with someone who's been with cancer, but there are certainly things that are hurtful.
Young adults have such different issues. They're at a transitional developmental stage in life where they're struggling for independence, start families, start careers, and then they're given a cancer diagnosis that puts them back. Jason and Jessica came to the group, and their story was just so amazing. Would you guys like to start today and introduce? Within months of each other, both of them were diagnosed with a cancer.
I was in a new job, trying to work long hours so I could be with her when she was in the hospital. After I was diagnosed, I had surgery, and about a month after I was back to work, they fired me. Said you weren't performing very well.
We're going to OHSU Center for Health and Healing for me to get my CT scan and blood work done that I get done every 3 months. It's really hard to work around all these scheduling of appointments. It was hard because there wasn't a lot of understanding about the fact that I had to miss work. I even had people say to me, your cancer has been so hard on me.
Some people stuck around for maybe a year or two, and a lot of people just took off because I think I just got scared, couldn't deal with it.
But I was really in love with my boyfriend who's in my band, who I've
we're best friends. And it just shook us. And I knew he wouldn't leave because I was the girl that needed, the woman that needed help. We were fighting one night and I just said, "Get out."
You may see someone who, in your clinic, comes across as being a very self-confident, outgoing individual, but then when you talk to them about what they do for fun, what do they have in the way of relationships with peers and friends and partner relationships, they may be very limited.
When I shaved my head, a lot of people thought it was because I had joined the military, and a lot of other people were just joking around, "Oh, it's cancer boy," but they didn't know that I had cancer.
It can be pretty devastating to find out you're not invincible, that this is hitting at a developmental kind of place and time where you're really not supposed to be told you have a life-threatening illness.
Being able to build support systems that involve other young adults is really critical.
I'd go to the store and I'd see people our age living regular lives, and I'd be like, I remember when we lived regular lives. Because one of the things that I remember, I was like, I just wish one day we'll be able to walk hand in hand again, and I just really had hoped that that would happen. It was a wheelchair for a long time, and then it was a walker, and it was a cane, and it was like, you could see the progression building and building. It was like, this is really exciting. The day that it happened was, it was really amazing because I just didn't know if it would happen again. So now every time we get to, I really do appreciate it. It means a whole lot to be able to do that. And
thank you. Thank you so much.
One
day we'll run side by side.
There we go. Or skipping. Skipping's harder for you.
Skipping's supposed to be exhausting for me.
That illustrates a little bit about some of the issues that this unique group presents with. I wanted to talk about some of the methodologic considerations, especially when we look at the research and interventions that have been done with this group. Just for all of you to think about when you're conducting research in your centers. I think typically we've combined this group either with a pediatric group or with adult survivors. And I think this has really obscured the unique needs of the population. When I go back and I look at the breast cancer literature, the 20-year-olds are in there with the 70-year-olds. I look at the pediatric literature, and really the 5-year-olds are lumped in there with the 18 or 19-year-olds. And so it's very difficult to get a sense at this point, except for some of the new data that's coming out in the last couple years, to really look at what the young adult, adolescent, and young adult group is. I'd also argue that we may be doing a disservice by calling them AYA and putting them into one group. And I urge you to really think about when you're presented with a patient in front of you or you're thinking about research that a 15-year-old is not a 39-year-old, and really separating them into the multiple developmental stages that are really in there. I think we really need more survivorship studies. I mean, I think at this point we just know very little about their medical and psychosocial needs, and while this knowledge is growing, there's still a lot that we have left to learn. What are our additional challenges? Well, there are very few of us that are trained in dealing with adolescents and young adults, and there's limited education and training of AYA-specific psychosocial issues for health professionals. I think this can be problematic given the multiple developmental and psychosocial challenges that AYAs face. So I think certainly liaison with people in the community who deal with adolescent and young adults, and figuring out whether it's a pediatrician, a developmental psychologist, or a nurse who really deals with patients across the age continuum. We need to encourage more health professionals to really seek this out because of their developmental needs. And I think there are issues about resources available. I think it's unrealistic to think that every center and every oncology practice is going to have resources specific for this group. Their numbers are small. But like I said earlier, and I'll show you at the end of this, there are some websites, and we should really be using technology to our advantage. So what are the clinical issues, and what can we do as clinicians and healthcare providers to help survivors and to address their needs? Well, I think first and foremost, we have to educate and communicate effectively with them. This is not a group that knows very well how to effectively communicate with healthcare professionals. So I think the onus is on us to really help educate and communicate them both about their late effects, long-term risks, both medical and psychosocial. By this, we increase awareness, we increase knowledge. We can help them mourn the loss, the things they have lost, their fertility, maybe role functioning, and then we can provide assistance and direct them to resources to allow them to really continue living. Another way to think about this, and this is another way I think about this, so this is the traditional sort of smoking cessation model, ask, advise, assist, but I think it applies to survivorship care as well. So in research, we've found that many adolescents and young adults feel that if their doctor or nurse doesn't ask, whatever it is, fertility, sexuality, if they're not asked, that they don't have permission to bring it up, and that maybe what they're experiencing isn't normal. And I think as healthcare providers, we have an obligation to ask and bring these issues up and then really advise them and assist them in finding the resources they need and help normalize the issues that they're experiencing. I think because they're so disconnected with other cancer survivors, their normal peer group is a healthy peer group, and we have to help normalize what they're experiencing within a young adult cancer survivorship framework. And like I said before, I think very few of us have the in-house resources. I'm fortunate to be at a large cancer center. We do have a lot of in-house resources, but I think we really have to really look at using the internet. And I provided some of these here. This is not an exhaustive list. I think it's in the booklet as well, but really looking at some young adult specific web resources. Many of you may have seen these. If not, I encourage you to go and look at them. There are some wonderful resources for you as well as your patients. There are also some web resources that I think can also apply but are geared more toward the young adult survivor of childhood cancer. And then these are web resources that I think are not specific to young adults but would be, provide assistance to young adults, like the Cancer Counseling Center. It's a wonderful organization that has career counselors that specialize in career transition, management, and advancement, and really do work with our cancer survivors. And lastly, there are actually a number of camps and programs for young adults all over the country. This is another way to get some of our young adult survivors connected with other young adult survivors. Many of these are free. They're funded by lots of organizations. They'll pay for the survivor to fly out there and be part of this. Survivors I've worked with who've gone to these will say it's a life-changing experience. And lastly, I want to thank funding organizations, which is the National Cancer Institute and the American Cancer Society, for allowing me to do the work that I do, and thank our survivors who really do help us better understand their experience and hopefully help the next generation of young adult survivors. Thank you.